All right, dear doctor. So this is your mentor back again. So this is Dr. Shahriar. We are going to start this particular session. I know earlier today, I have recorded because so many people ask one question that doctor, how would we get this access and the materials actually? Now, those of you joined, we have already sent materials except for in last hour, one or two people maybe joining and not getting it. It can be different, but I think since last night, I think everyone joining, we have sent the materials. You can check now, actually. Second thing, those of you who haven't subscribed yet, of course, after today's class, you will be thinking about subscribe, what you are getting, what you are not getting. All right, so I'll tell you three things here, actually, in this particular area, if you can see the screen. And I think we already mentioned as a loud and clear, so voice and videos are clear. Now, in this one, I mean, first of all, this batch is batch 68. It's a 3 months course, and in this 3 months course, let me guide you through the very like few things before we start our session. I'm telling you today it could be a long session because we'll be discussing two things. One, that is that April recall actually guide you through the course. And at the same time, there will be also, as per the routine, like there is some July thing. So a long class alert, actually, So, I mean, if you can stay, that's okay. Now, what we're going to cover in this batch 68 MC, because mind it, we have been taking classes for very long, like in it's 9.5 years actually, and it's over 2000 with more than 92%. I mean, previously it was 95, but exam is being difficult over the time. Every hospital I know, some of the doctors who are working, some people are switching, I know, hospitals, that's a different thing. Now, coming to this particular course, 1 year plus live we will do for you. Routine already posted in our group. If anyone didn't find it, by the end of the class, we'll definitely show it to you. Or yeah, no worries on that one. Or maybe I can post that routine for you here. Will be good for you, I think, at the same time. Just if you just give me a second, I'll give you some seconds to um, download that routine. So batch, yes, here we go. That batch 68 routine. Yes, you can also download this routine here actually. I just posted in the Zoom. You can just download it, or it's already given in this particular group. So coming back, so 1 year class live, 5 years. I mean, you can understand 5 years. If you were a genuine academy, you cannot, so many records come, so you cannot do, but the recording and the files with the references is already given, which I will give you demonstration. SMA notes will talk about it more, ebooks and question bank, and of course, support group during the exams will be definitely given. Now, coming to this particular part, this how to access actually, there's two like, variation here, especially if you open with a laptop. With mobile, it's same as well. Some people has a disorganized view. Now, we're talking about that particular note, and what do we mean by the note? It's a dedicated, like the I would say one of the best and dedicated, because so many people make notes, this and that, but this one is particularly made only for the AMC actually. So it's like specially designed note for AMC actually, So you should like, for example, if I just click one of them, how it look like. Yeah. So if you see, it's dedicatedly for like, AMC actually, So this is how one of them look like actually. So anyone, if you click, yeah, some could be longer, some could be shorter. It's many years of experience and things, which is exactly needed for the AMC. And I'm just clicking randomly, guys, actually, so, see, it's one lot of one-page notes out there as well. Yeah, so different types of note and things out there, very nice, colorful, made over the years, say 7 different things you need to know about the pneumothorax. So this is how the SMA note looks like. Talking about the SMA note, it's a complete note, every single topic's given there. It has two views. Some people use this view, but since there's too many in numbers, I prefer this view, which is called list view. Let me know in the comment section which view you guys like. Do you prefer the, you know, list view, or do you prefer, you know, yeah, you know what I mean? Do you prefer list view, or do you prefer the other view actually? Great. Yeah, giving it just a second pause. just you guys to observe what just has happened. And those people we have sent materials is already it's given actually. Great. Okay, that is wonderful actually. We're just sharing the link. Some people looking forward. So just this way, just taking a second. Yeah. Great. Just give me a second. That's the question. Great. Okay. List view is better, right? For organization and all these things actually. All right. You can only view, cannot download this particular part, by the way. Okay, if you check our website, this is about the course. You can find more detailing about the course thing. We have the exam support. We don't charge separately for the exam. So we're the first academy to start actually this exam support. We thought it's only, I think, should not be charged separately. We also give lots of effort during the exam in that 4 or 5 days, but we don't charge separately. Some people might charge the same price just for the exam support. So our exam support is totally included. Yeah. So previously the course is 299 is 250 if you join in this particular few days actually. All right, actually coming back again to this particular part, other than the SMN note, what you are getting. Note can be very useful if before exam if you revise, so it will your theory will be tightening. Understand one thing, we have a 5 months course. If anyone is attending this class and fully fresh in MC field, actually just past MC, never studied MC much, then there is a separate batch coming up on 17th of May, which will be much bigger and larger. That includes the support. We also teach the SMN notes separately and also John Murtak separately. So those part usually does not come here, but we give that note here actually at least. All right. Next coming is a like the main titling thing is the recall. I mean, you heard about recall, or maybe you're new, or you are already studying. You know a lot of things about recall. Recall is a myth. Recall has two things. One, some recall collected, fractionated term recall collected. We make it little bit bigger from our experience actually, that this is how the question is. When you were a teacher for 9 years, of course, if you see a topic, if you see a fraction, you can immediately realize. So some recall when collected from the student, they just tell us, doctor, there was a management of pneumothorax. Now I know like how the question has been tested in past. Actually, I can type from my files previous, like 10, 12 years of collection, I can find it. So that is how a lot of things we made. That is being SMA is one of the most genuine recalls you can get through actually. And you can see any folder, see, this is May we are starting, so till April it has been updated because May recall exam or May exam is not started yet. So as long as those of you join, when the May recall will come, it will come in June, it will come in July. So things will come in. We'll also give you access to this course, the full, I mean, recorded and things. And at the same time, we'll also give you access 6 more months extra when you are joining us actually. Now, if we click one of them, like, okay, say this is another one. This is how it looks like. By the way, December, January, if you're trying to find, it's not there because December, January, there is no MC exam. Now, if I click any one of them randomly and a video file, now clicking any one randomly, this is how it usually looks like actually, so um, this is how, yeah, it looks like. Yeah, thanks. All right. So you see John Murtak reference. I prefer more John Murtak reference than anything because that's the main textbook actually. Then of course RSCGP is important, some Australian things. Books are made from so many references actually. That's why any textbook, like example, priority John Murtak first. Then if it's a medicine, Davidson reference first actually. So rather than any single uh, like a article or anything reference, any textbook reference, if you get, that is always being a priority. Is that clear, everyone? While you are searching or hunting for any recall or a reference which is right, the textbook answer is the most corrected one actually, because textbook is made from so many genuine article. Like for one single, say pneumothorax topic, they reviewed like more than 100. That's how the textbook are made. If I go to any others other than the 2025, let's say 2024, randomly we pick up any. So you see many files out there, as you all can see. If I click any one, so any file would be opened up. Yeah. So this is how, it will look like. This is how it will look like. Yeah. So, it would be helpful if you just go through it. Yeah. All right, so this is how, randomly I'm opening some of the files for you just to get idea. And you can always check from the Google Drive share with me. It's very easy access actually. Okay, talking about mock, very important. There are a lot of, already useful mocks are given, but we will be taking computerized one. Computers and I can show you now because it's computerized actually, definitely. So when you start, there will be timer and this, that things are given. So when you start, definitely timer will go on and it's very road rush type of experience, like exam type of experience. 3.5 hour exam will also contact actually, that is also included in this note, included into this particular our packages. Now speaking about the routine, class routines are given here. As you can see, today's orientation, we just gave you the orientation. Material distribution, those joined already given the materials, those will be joining also given materials. We take 24 hours time because of time zone differences. So send materials 24 to 48 hours to send materials, because also your payment can get clear in 24 to 48 hours. We will be doing to the July, but as a bonus, we'll be also doing some April records at the same time. All right. So as long as you see progress into July 2025, 25, 25, 25, then we'll be also doing that 2026 at the same time. And in coming days, see there is a May exam support and exam recall going on. We'll be also including that. June will be including, and also 2026 in between, we also included. So it's literally more than a year live you will be with us, and there will be exam support. Now, if you have any short question, you can ask. Otherwise, we can just immediately jump into the recall solving things actually, guys. So this will be two session today because long class alert. First half, we'll be solving some April. April is very new, very raw. Still a lot of updates and things are going on. Still some of the updates. What's an exam support? Exam support means during exam, say if you have an exam on third day or fourth day, during exam we also take classes for you actually, and help you solving the recalls actually. Yes. Yeah, of course. Any of our student joining, definitely exam support. Even if your exam is on November, your exam support from us would be, available actually. How long we have access to three? See, its course is starting May, June, July. Clear. Then another 6 months, then August, September, October, November, and the December. So up to this whole year, access would be there actually. When you will send materials, already materials sent. If you just now joined, maybe you didn't get it. In that case, contact us after the class actually. Yes. All right. It's already 5 years. Exam supports and this that things are given. Access will be given up to November, guys. Access will be yes. Yes, good question. Any recalls after this will be the August month actually. If anyone is targeting November, I think you can also consider joining the August batch. But the sooner the better actually. The August batch has lot of rush. Yeah. Great. Live classes timing like today, it's a Friday and the Monday. Some cases extra classes will be taken. Thank you. Extend your access, yes. With $50, you can always extend the access for us actually. And even if you fail in exam, we allow you for free taking actually. Yeah, of course. This whole 7 days, our admission things would be open up, my dear doctors. I think we can take this question in the break or at the end, guys. Can we start now? Because two bigger files are coming up, actually. Okay, you can leave me a question in between the break. Let's go and start because people are hyped up for the class. I'm going to do the April one, which is the very latest. I'm telling you, we are keep updating lot of files and things. So few things uh, yet we are considering can be updated, especially from April, which is the latest month, we have. So in between break, we can take few questions, my dear. Okay. I'll definitely take your questions actually. Okay. Starting with the first one, a very common one, complex one. Neurologic people find complex, but after our neurologic class with the regular batch, I think a lot of people find it good. Now, coming to this one and discussing this one, I'll read the question. I'll give you 30 seconds to read. 30 seconds to answer later. Okay. So 45-year woman, which is in an ophthalmologic clinic. In those countries like Australia, there are clinics actually for separate. So either a GP or either like ophthalmologic clinic. Progressive visual difficulties on examination has lost one particular eye, not both, because considering the visual track, which I will teach you guys. Uh, so both eyes or one eye, it is important. So it is one particular eye which is affected, loss of vision on the, all right, inner side, like nasal vision side of okay. So nasal examination remarkable. Yes. So where is the lesion is most likely located? Interesting question. So I'll give you 10 more seconds, guys, to think. So we can see kind of it's like a both eye getting affected, right? We can see, well done, guys. So both eye getting affected. Certain condition both eye get affected. If nerve is affected, let's focus on this particular picture. I'm sure in the med school we'll learn this thing. It has a two section. One, this disease section. One is the pathway understanding. Would you mind if I explain in 1-2 minutes this right hand side pathway? Is it okay, guys? One more time. Yes. Now, uh, maybe I made a replica. So this is the eye, and this is another eye. So I made this thing like this: eyes, and this is a eye. If you see the eye, say this is right eye. I have two side of this eye. Okay, if I see the vision, we can see from this side and that side. So if I close this left eye and only focusing on the right eye, so this is my temporal side. So this is temporal vision. This is nasal vision. Clear? Right. I'm closing the left eye. I'm focusing on right eye. So this side, temporal bone, temporal vision. This one, nasal vision. Same thing. I'm closing this eye, left eye. This is temporal bone, temporal vision. This one, nasal vision. Okay, up to this, it is clear, right, everyone? Because nose is here. This is I'm trying to draw here, actually. Now, we have some track, we have some fibers for the both eye. So, one is a nasal fiber. I repeat, one is a nasal fiber. Focusing now. Can you recognize from this picture, if I made it a little bit longer for you, which one do you think is a nasal fiber here? Red one or a green one? Simple question. Which one do you think is a nasal fiber? Red one or a green one? Just to make you understand, guys. Final answer. Final answer. See, nose. Close to nose. The red one, what do you think? See, this one goes like this. All right. If you see this, like one coming green, coming like this. Okay. This is a green one. Green one. This is away, my dear. Green one. And there is another one, red one. Red one crosses like this. The red one directly crosses like this. So the red one is a nasal fiber here, whereas the green one. Now the game begins. The nasal fiber, the nasal fiber actually sees the temporal field. That's why our eyeball is kind of like a visual acuity axis. Nasal fiber watching temporal view. Nasal fiber watching temporal view. Temporal fiber, which is the green one, watching nasal view. Please confirm if this thing is clear. First of all, green color fibers are nasal fiber. Green color fibers are temporal fiber. Red color fibers are the nasal fiber. Let's take one of them. This red color fiber is a nasal fiber close to nose, and they are watching this side, temporal field. Clear? Okay, based on that one, we will do some formulas now. Example, coming to the very first one. What is the very first one here? Is a optic nerve. Now you see the whole one particular uh, nerve contains both fibers. So both are cut off. If both are cut off, both are cut off, what do you think? Like one, which particular fibers are cut? I think both fibers are cut. That means nasal fibers are cut. That means temporal fibers are also cut. Is it clear so far, everyone? Both fibers are cut. Now, nasal fiber has temporal view. Is it cut? Yes. Temporal fiber, green one, has a nasal view. Is it cut? Yes. So number one, cutting the both fiber, the whole left eye would be blind. All right. Currently, we are doing the April recall, my dear. Thank you. The whole left eye. So considering nasal and temporal, which is containing. So this is the view now you're getting, which is totally become blanks. Now, second one we are coming, and the second one is our question answer. Let's get back to the question. You can see outer temporal side, outer left eye, and outer temporal side affected. Inner nasal side of the right eye. So you guys choose. Yeah. Okay. Okay. Now, coming to the next one, it's a place that is in between the both. That is something in between the both. Actually, let me explain this one. I think the rest you can correlate. In the second one, same like this. This is just drawn. So both one particular type of fiber is cut actually. It's the red one, which like from this side goes to this side goes to this side. That's why in between two eyeball there are connections. This particular area called optic chiasma. And can I say the both nasal fibers are cut? Agreed, everyone? Please mention agreed. We don't want to take much of your time. Is both nasal fiber. Now, nasal fiber has which field? Can you tell me? Both nasal fibers are cut, but nasal fiber watch which particular field? Nasal fiber watch this field. Nasal fiber watch this field. Like one nasal fiber watch this temporal field, one nasal fiber watch this temporal field. Like both side. Both nasal are gone. So now can you see this blue color is like a black color, which is affected now. So the second one is related to bitemporal hemianopia because of both nasal fiber cut. Everyone clear now? This nasal fiber watching this field, both this particular fields are gone. Okay, one more you want? Yes. Okay, last one. Last one, which is more related to our question. If one particular now we after the nerve, the chiasma, then comes the tract. Then comes the tract. Now you're cutting this tract. All right. Let's say, let's say if we cut the, let's say if we cut number three, this particular left. If you get the left one, is both fibers are cut or one particular type of, we can see from this one, this both fibers are cut. One of them are cut is a temporal fiber, green. One thing that is cut is a nasal fiber, but this nasal fiber is going not in this direction. This nasal fiber is going in this direction. Okay, like in the first one, it was related to one particular eye, but when it is coming to the optic tract, one fiber belong to this eye, one fiber belong to the another eye. Is it clear? That's the difference between the optic uh, tract and optic nerve cutting, right? So number three cutting. Now can you tell me if this particular nasal fiber, temporal fiber is cut, If temporal fiber is cut, then which field is gone? Temporal field or nasal field? Temporal fiber cut, so obviously temporal fiber is watching the nasal. Nasal is gone. Left-sided, temporal fiber cut. It watches the nasal field. The nasal field is gone. Correlated? Yes. And this one, the another nasal fiber, which usually watches this temporal field, nasal fiber watching this temporal field, that is also gone. So this is one of the fiber also watching this direction. This is one of the fiber also watching that direction. That is one of the reason homonymous hemianopia. You see this one and this one. Is it clear to everyone? Why it's not same like before? Why it's little different now? Is it clear? If optic track is cut, again, temporal fiber cut and a nasal fiber. This temporal fiber supplying left eye, this temporal nasal fiber supplying the right eye. So both eye would be affected. Temporal fiber watching this field, this field. So this field is gone, and this particular one is a nasal one, which is watching temporal field. That one is gone. So highlighting here is this one. Harmonious hemianopia. Comment in the comment section. You just need to draw 1-2 times and practice 1 to 3 times. It is clear actually. Our question, I think, justified. It was related to right optic track. Clear now, everyone? Our question is more related to not nerve. It was related to track. Great. That's why both eyes are affected here. But it was a more molecular discussion considering fiber, considering nasal fiber and the temporal fiber. All right. Great. I hope you enjoyed this part. More things are written. I think you can check it. I'll post these files. Don't worry, you get the full file actually. All right. We have already discussed. Can you go to the next one? Little longer discussion, but I think so many people have confusion on that one. Yeah, the next explanation will be shorter, definitely. A baby born with hep C antibody positive mother. See, mother having HIV, mother having hepatitis, mother having this, that, baby can get this thing by vertical transmission. That is the concept. Mother confirm hep C. We call it hep C in Australia with a detectable viral load during pregnancy. Baby appears healthy at birth and no sign of jaundice or any distress. All right. Because of distress, why I say it? Because accommodation in the liver has a lot of toxic thing and gives rise to hepatic encephalopathy. That's why it's such. So jaundice or distress. What is the appropriate next step to management of this neonate? Guys, you have 30 seconds. Okay. Baby appears healthy at birth. Actually, that is the great news. But would you like to clarify that baby does not require any further test and this and that? So is it a B or a C, which is more prioritized, most appropriate next? Most appropriate next would be at now birth and another one later. At now birth and another one. For now, doing the test at the time of the birth is more important, and later another one later would be important. Same goes with the HIV, if you guys know. We do one time just after birth and do the testing later. This kind of concept can be used. I repeat, this kind of concept can be used like hepatitis B, hepatitis C, HIV, and some of the other viruses. Clear, everyone? So this one, the C is a prioritized answer here. C is a prioritized answer actually. So the summary thing is there why the other one is not answer. You can tell, doctor, because it's at birth and later. After later, you can also do it as per the Australian guidelines actually. All right. So about this one, some people choosing will do it later. I mean, it's not like we're not doing it. We'll do it definitely later, but at now, most appropriate doing this one now actually. So some of you just got tricked a little bit. Okay. Here's the number thing is given. It's just required a formula. This batch will have a bar step session separately, which is not given in the routine, but I will add something for you guys actually. Great. Now, here we go with this one. Here we go with this one. These numbers are given. You just need to use that formula to make it. So sensitivity test, it depends on TP by TP by FN actually. So this one is a TP. So if you just do the on the top that TP and by that one is TP plus yeah that yeah FN. I think you will find it actually. Okay, if you just do calculation, it will come 80%. That's all actually. Okay, good question. That doctor, I mean, is calculator is given in MC exam. One of the doctor asked in the last batch, what is your idea? Would you get a calculator in that exam day? Just asking, your thoughts. Of course not, actually. So you will not get calculator. You cannot bring anything from the outside as well. But there's a slate given, small actually. In that slate, actually, if you want to write something, that's okay, actually. All right. So that's one of the thing. You will also get earplugs. Understand one thing, if some cases you are very unlucky because in Pearson there is also, the SAT exam for English test. Yeah, so those people also come. So some of time, you find some people coming and writing things like this. So someone to disturbing candidate can be near to you. So it's better to ask for the earplugs from the beginning of the exam actually, or they will give you in some cases from the very, very beginning actually. All right. So keep it in mind actually, just so that later unnecessary times does not go. The first question in your screen in MC will be a demo question. It does not have any marks actually. All right, great. So this one is the 80% thing. This one. So biostat epignosis they will include in this one actually. Now coming to this one, another one here. First, you need to tell me a diagnosis after I start finishing the question. 4 day. You see, highlighting point here is just a 4 day jaundice since day two. O neg and baby is yeah, A positive actually. Mother negative, baby positive. Okay, but baby is feeding well, but dad positive. I'm sure you are getting the diagnosis in your mind. Before going for answer, tell me or give me the diagnosis. Then I'll understand you understood. Okay, some saying physiological. Is it? Feature does not show it. See the mother baby, see the jaundiced. All right. Now, going for the answer, yes. Incompatibility, I think we preferred line incompatibility. What do you think? Hmm. If incompatibility, that will lead to hemolytic issues. Incompatibility leads to hemolytic issues, actually. So let's go for the final answer, guys. Agreed? What do you think? Okay, so baby with ABO incompatibility. Now, this is the classic. This is the classic mother, oneg, baby, positive. We have a DAT. That is confirming this is hemolytic disease of the liver. Why that test name is given here? That will confirming hemolytic disease of the liver. Okay, we are quite sure now. Now, for this one, they're treated with IVIG. Now, here is a small thing. How many, those of you from my 5 months course also can tell me, IVIG is a treatment for which other following conditions actually? At least maybe three if you name, I'll be really happy. Yes, please. Kawasaki? Okay. Then GPS. Well done. Anything else? Come on, guys. ITP. Okay. Samsung MS. Okay. Anything else? Yes, of course, this one. Hemolytic cases. All right. So we got it, but more names out there actually. You can check it actually. So if you compare and contrast things, it's always useful to memorize. Next question. We understand? I mean, we have two sessions today, bigger session. So first one is we are doing the April 2026. Now, 26-year smoker and smoker has so many problems, but we have to check which one is first. Like pain during walking, limitation for him 100 meter is nothing. Walking 100 meter having pain, that is suspicious for smokers. ABI, is it a good ABI or is it a critical ABI? Dear doctors, is this a good ABI or is it critical ABI? Someone said is the right diagnosis is an intermittent claudication. I mean, walking in a little distance, intermittent claudication, that is indicating a vascular problem or neurological problem. That brings us to the next question: vascular or neurological? Vascular or neurological? All right. So this one is a vascular problem actually. ABI, you can see, is not showing something great for us. Most appropriate next step in the management for this chronic limb ischemia. It also has a mnemonic, right, guys? Chronic limb ischemia has mnemonic. You can Google it. Chronic limb ischemia mnemonic. You will find so many like a mnemonic with P. Yeah. Now coming to this one, in this particular case, do I need a surgery? That's the main thing. Again, in this case, do I need a surgery? Is this a critical limb? There's a term I wanted to add. Is this a critical limb ischemia? There's another term, that is the red flag. Critical limb ischemia. That's the main differential. And also, you can say any neurological condition can be a differential. So these two are the DD, critical limb ischemia, and neurological condition, neurological, like spinal stenosis. Spinal stenosis. Now, someone can tell me quickly why it's not spinal stenosis. Someone can tell me why it's not. If it's a critical limb ischemia, it has to be more than less than -3. That's how it is actually, or -4, or some book says as well actually. Okay. Now, spinal stenosis also can have similar problem. Walking can cause problem. Okay. But they didn't explain this thing. Is it a uphill or downhill? Now, in neurological cases, both up, both down, doesn't matter. They always have pain. It's one of the thing. Great. Next, yeah, that's the thing. Here we go with about that one. So in neurological claudication, this left hand side for neurological, and this one for the right hand. Yes, someone said it's AB, ankle brachial pressure can be also very, very important. Yes, well done. Also about scenarios like going up, down, both. In this case, up causing more pain, like against the gravity, more blood consumed. Can I also say bowel bladder issue? Can we also say this thing that neurological cases, bowel bladder thing, you are expecting some issues like here? Okay. Also, vascular claudication, when you take rest, the pain goes away quickly because it's vascular, blood related. But neurological, it doesn't always matter actually. The pain is a quite a constant actually. And another thing, always not 100%, but about the pulse, because the vascular, is it possible the pulse can be diminished or absent? Because it's vascular. So if it is a very critical, in our case, it was not mentioned because it's not critical. But if it is so much, it's like a MI of the limbs. Can I say like that? Yeah. So in those particular cases, it's too much narrow, then you might not get the pulse at some point. Actually, I remember in my internship there was just entered to the OT, some of our friends. One guy was literally shouting, please do something, please take away my leg, whatever it takes, actually. Yeah, so that's the thing. Great. Is my audio is clear, guys, actually? Just taking one time. Audio, is it okay? Yeah, I think it's okay. Yeah, audio fine. All right, I do the person's problem. All right. Great. Coming to this one. So are we clear, guys? Are we clear with critical limb? This is a regular limb ischemia, DD, critical limb ischemia, and the DD, neurological. I hope that's clear. So this answer can be also surgery if it's more critical. Guys, about anticoagulation, because it's a new batch, I'll talk more about anticoagulation, warfarin anticoagulation coming days. Small information inside the SMA note. If you go to the surgery section, okay, you have to go alphabetically. In the surgery and also in the pediatrics, you'll find two notes named anticoagulation. This too, I highly recommend. Regarding that, there are five scenarios given in that note. So if you check that one, it would be really, really helpful. One question is quite popular. One question is quite popular from this warfarin related anticoagulation, warfarin, and many other drugs interaction. Clear? Are you taking small notes, guys? These are side notes. These are small side notes, like outside the class, but you also have to check. Now, going to the next one, going to the next one. So supervised or exercise training can be regular cases, and very critical cases, red flag cases, you might need surgery in those cases. All right. I would like to talk. I mean, guys, sometimes I talk some things outside because of experience. I hope you don't mind on that one. Example, there's another question. They mention this word, you know, reduce smoking. Okay, now question is, peripheral vascular disease or Burgess disease, reduce smoking, is that a right answer? I'm talking about another recall which I have seen in past. Reduce smoking, is that a right answer? Or what do you think? Cease or quit smoking is the right answer. So that particular term is not correct actually. It's not a thing that, like it's not a food, like a reduce trans fat. Cease, quit. All right. So based on that one, there was an old recall. In the option, it was, supervised exercise program versus it was given reduce smoking. What do you think? What is the right answer? Supervised exercise program or reduce smoking? Which one is the right answer? So final answer in that recall was supervised exercise program. Now, if the question was given quit smoking or cease smoking, then which one do you think is the answer in peripheral vascular disease? Then first would be the cease or quitting the smoking. Understand one thing with the COPD, it's also the same. In the COPD cases, it is also absolutely important to do those kinds of things. I'm going for the next one with the 17-year pregnant mother with exposed to measles. Just to add one thing, as per the WHO concern, in very recent time, since last 2 months in Bangladesh, especially March and the April, I'm not sure how many of you know, but the measles has been outbreak and has become endemic in Bangladesh. I'm not sure you guys know it or not. So there can be a question in future, you never know, because it's not outbreak since very long time actually. So it's currently endemic now. I don't know, it's a vaccination failure or whatever it is. So WHO is seriously concerned, guys. I think you guys should know about that. This particular actually, that measles has been outbreak in Bangladesh in last 2 months in 2026. Now coming to this one, no documented vaccination, very important. IgM positive, IgG negative. She feels unwell, but no rash yet. Exposed, but no rash yet. Most appropriate next step in the management. Here we go. 20 seconds for you. Yes, yes. Go ahead. I want everyone to participate. This gives you more energy. All right. IgM positive. That's one of the things. Okay. Quite tricky. And we are thinking, especially in between two. One, it's a giving that immunoglobulin thing. That's one. And another one, I mean, these we're not getting here. Uh, Repeating the serology, many pregnant women who is exposed. I repeat, many pregnant women who are exposed. Then there is a thing coming. Repeating the serology, very popular, like rubella. like these measles, get exposed, then parvovirus, right? I'm giving a lot of examples. So this particular another one you should check in the main exam, like parvovirus, rubella, right? Condition like measles. Yeah. So in between C and the E, which one do we think is the final answer? One more time. This question addressing IgM positive, not IgG positive. This is a important hint for you. Okay. Now, what does IgM positive indicate to us? Indicating active viral replication, or it is active somewhere. Active infection, recent infection. Best word, what you learned from the med school, recent infection. I think IgE, there are some few things available in Hep B, like active transmissibility, but IgM typically means recent infection. Now, if it is a recent infection, we prefer picking up normal, yeah, this thing. If in this case, if IgG would have been positive, then what would be your answer? Yes, we're going through a tricky part. Please understand the question well. If it is said that IgG positive, immunity and things are developing, okay, in that particular case, then E would be the answer. But IgM since positive, in this case, I think we think about it's acute, it's recent. So we have to take yes. Okay. Another important information, why not vaccination? Can we vaccinate? Do we need this information, know this information that MMR vaccine is a live vaccine, right? I repeat, is MMR vaccine is a live vaccine? Yes. And live anything contraindicated in pregnancy. So positive IgM with negative IgM, so recent infection, all right. So MMR cannot be given, so immunoglobulin provides passive immunity, at least in this case. And it should be given within 6 days of the exposure. Is it clear, everyone, why we picked up C here actually? If it were, the same thing would have been IgG or positive, then we'll think about going for a repeating it because immunity is developing. Okay, let's repeat it after 2 weeks actually. All right. We'll talk about some of the vaccine thing in the future if I get some separate time. We'll be definitely talking a little bit more about the vaccine. There are rabies vaccine, there is rubella vaccine, there's some other things. I think we'll keep it for there because today we have a long session. Okay, dear? I mean, I'm sure I'll get back to you on the vaccine related thing actually, my dear. Yes. Next one, two option because of that recall actually. A 55-year old person with a 3-month history of right shoulder pain and MRI reveals full thickness this tear with a biceps tear. Oh God. Okay. Unable to lift anything now on that particular shoulder with a significant functional limitation. Of course, when your shoulder is affected, uh, quick question, shoulder joint, strong joint or a weak joint? What do you think? Interesting question, right? Is shoulder joint is a strong joint or is it a very weak joint actually? Shoulder joint is actually kind of, I mean, there's so many things at us. So let's say if you have so many channel in a electric wire, is it more vulnerable? It's kind of like that actually. Yeah. So many attachments are there. So in a way, it's vulnerable actually. My question was not right actually. It's not really a weak, but let's say it's a more vulnerable joint. Am I right with the question now? I mean, which particular joint is very vulnerable? Because so many, it's very, very vulnerable actually in the supraspinatus. I even had injury with the infraspinatus. Would you believe? Yeah, doing the shoulder things, sometimes ego lifting things come out. So, but it was like nothing there. I mean, some cases strain or things were also there, but in my case, infraspinatus was affected actually. Right. All right. We'll review the last question, my dear. So let's focus on the current one. All right. After class, I'll open a inquiry zone while you have the inquiry. Yes. It is a strong, but I think vulnerable because of so many ligaments, this and that actually. Great. And so much in use as well. Okay. Most appropriate. Let's focus on this question. Let's focus on this question. What is the appropriate management in this case? Full thickness steer. Full thickness steer, biceps steer, biceps tendon also gone. I don't know what he was doing. Certainly, it's a surgical repair. Certainly, definitely 100% surgical repair. You see muscles? Yeah, not significant actually. Yeah, it's suddenly like a small elevation, like a not like a equal actually. Suddenly, it's like more like Popeye. Some people say, you know, Popeye the sailor man. So in that particular suddenly small elevation actually. Great. So anyways, actually suprarenal commonly get affected, especially those are into works in working age patients actually. Suprarenal more with the working age cases. Yeah. Some answered physiotherapy for them. That is answer when there is you mentioned partial. When mentioned partial, but this one is mentioned full thickness. Clear, everyone? Please mention as a clear. We just will move to the next one. Okay, next one. This time a 28-year female with pregnancy, 20 gestation, onset of abdominal pain, pelvic. Heart rate is this, abdominal tenderness, and ultrasound showing enlarged right ovary with absent blood flow, like reduced and absent, very big thing. Reduced is a different, absent is like horrible. What do you think? Final answer, I think you should not by symptom if you focus. It's a definitely a torsion. So ovary affected, right? Enlarged right ovary with absent blood flow. So it's a torsion case. Is it an emergency as like testicular torsion? Definitely yes. This can be some of the particular features with ultrasound showing absent blood flow. It's a surgical emergency. Check out the John Muttak lines. Yeah, so same lines as given. Vomiting, pelvic tenderness can be ultrasound, and of course, is it required surgery? Very simple answer. Yes. Next question. 30-year-old with a delivered 5 days ago being brought by her husband. She's agitated. Young female. And why she was brought? Because she's agitated, couldn't sleep for 3 days. Believes in spatial power. Question is going in probably psychiatric direction. Which psychiatric direction we have to rule it out? No previous psychiatric. For psychiatric patient, very important. Previous incidents like this, someone in the family like this, very important question. We gone through the physical examination. It looks normal. Most appropriate initial pharmacological management is asking. Guys, if you check our SMA note, it has very nice psychiatry section. Okay, so one you will find full psychiatry note with all important chapters this that given. You will find another note with a psychotherapy, very very important, and you will also find uh, like pharmacology related to psychiatry. Pharmacology related to psychiatry. All of them are so important for you. Now, coming to that one. She's agitated. So what do you think what we can do at this case? Should we go for quetiapine? Should we go for a haloperidol at this point? Yeah, we're coming to the point. No worries. The bigger, I mean, E is out at this point because it takes time and it is the last resort. Two options. One is a haloperidol, which is the most popular one, especially in yeah, and one is a quetiapine. You see, most of the MC question they offer you haloperidol. They don't usually offer both of them together. Yet, even in current status days, haloperidol is used because it's most commonly available actually. All right. Patient, I would say, has both kind of like agitated and psychotic episodes actually. All right. I'll give you 10 more seconds if you want to add something. Yeah, certainly. If I differentiate in between these two before going for any finals, uh, often given, both of them given IM in these cases, IM. All right. So in current status, in this particular case, because both been offered actually. So both are used actually. First of all, now question is which one is used more? So haloperidol is a typical one, and quetiapine is a atypical one. Now, our condition is called postpartum psychosis. It's an emergency. It often occurs in the first 2 weeks, characterized by a few features which are already mentioned. Now, quetiapine is one of the featured first-line atypical antipsychotic in postpartum setting, actually. Now, if quetiapine is not given in the option, in that case, it's always been a help. Mind it, haloperidol has more side effects, those we call extrapyramidal side effects. Please check our psychiatry note about the extrapyramidal side effects, actually, with mnemonics like a 4 A's. All right. So those questions you would see mostly in that those questions you will not be offered both of them together. Most cases in the question you will find haloperidol. Your answer can be haloperidol in agitated psychotic patients. Not so often you are offered both of them together. If both of them offered together in between typical and atypical, which one to prefer, guys? If both of them offered together typical and atypical, which one is preferred? Most cases, atypicals ones are more preferred. Very basic. But more popular, the question comes with the like you give haloperidol in the option, you give benzodiazepine in the option, you give ECT in the option. So you don't have to think much about quetiapine, and we are more used to with haloperidol answering. But this question is more about testing your pharmacology knowledge. That typical is more better or atypical more better. Of course, atypical is more better. Now is it clear, everyone? This question, how different way it comes actually. Great. All right. Don't forget to check our psychiatry notes section today. Take a small note. 38 years with a emergency with worst headache in life. When there's a worst headache in life, a lot of diagnoses are coming in my mind. Sudden onset while exercising. So there is an event. He briefly lost consciousness, vomited twice. This is this. That. Non-conscious CT performed 2 hours reported normal. Okay. Likely diagnosis. A very interesting question. I think most of you are answering it very quickly, so let's not take time. Worst headache ever, losing consciousness, vomiting twice. Even though GC is given 15, but I am afraid maybe it will be 13 very soon, or it will be gradually declining very soon. But Initially, they might not show as classic symptoms, but every minutes it can deteriorate. So it's a classic subarachnoid hemorrhage. Keyword, keyword for subarachnoid hemorrhage here, or headache, or headache, losing, started losing. Yes. Non-contact city percutaneous has no. Now, is it possible that subarachnoid hemorrhage? I want to highlight this section. Subarachnoid hemorrhage, is it possible hemorrhage, city normal? Is it possible? Very much possible. Very much possible. That's why we repeat CT or we do the lumbar puncture. Tell me one thing, extra line. Now, with the CT scan, maybe second time or with the lumbar puncture, neurologist get to know or neurosurgeon get to know this is a subarachnoid hemorrhage. Before doing the surgery, what investigation the neurosurgeon will perform? This is an exam question. This is an exam question. CT angiogram. You need a road map before opening the brain. Very important. So here is your line, my dear doctors. So normal CT does not rule out subacute lumbar puncture may be essential in these cases. When you know it's subarachnoid hemorrhage, you need CT angiogram. Clear, everyone? Yes. Clear, clear, clear. Yes, check. Subarachnoid. I feel like a frog, or what do you like to compare it? Is sitting in front of the brain. This is like normal. This is what do you think? Starfish. I mean, I remember the the at A levels we do the dissection of a frog. You know, the opposite side it looks like that. Spider as well. Yeah, spider. How you remember that's up to you actually, but make sure you remember it. Okay, next one. Interesting injuries. Okay, 22-year football injuries while tackling. Effusion, McMurray states elicit some pain, but negative with internal rotation. Vagus stress, anterior posterior direct test negative. Come on, guys, what do you think? After tackling, there is effusion, McMurray is positive. So I think, um, what do you think? Moderate level of effusion. Moderate, not so much. I'd like to add things. I mean, this one I also tell in my 5 months course batch. I have a next door neighbor, like, living, a gentleman. Yeah, yeah, of course, we'll upload the recording, definitely. A gentleman, and someday I got called because I'm a doctor, and then my mom said, okay, please check your one of those uncle has problem. Okay, I went and I found, his leg is a bit swelling, and he's telling I'm having pain, while went for jogging, I feel like twisting, and I said, did you do something awkward? That's the word. Yeah, I was like jumping and twisting, yeah, and just suddenly twisted. Okay, I said like you should go to like orthopedic department. I think they will do some more tests. I just quickly referred actually. Now, 3 4 days call after this incident, I got called. Now I went there and I found a huge swelling. I was also surprised. The next question, you didn't went to the doctor, right? I mean, in orthopedic, no, I thought it would be fine. Other people told me this, that you must be knowing, when you're living in Asian country, your value as a doctor, I mean, is not too much, especially your home family, neighbors. People are after so many references, actually. They don't, I mean, they ask, even sometimes they listen to the pharmacist because they're up to selling that medicine. Oh, you get this painkiller, it'll be fine. Doctors, they are just taking money by sending investigations. Yeah. Now, that thing probably has happened. Now, referred, they do the arthroscope, they find out, meniscus tear. Now, what summary we have here. Initially, the meniscus injuries are smaller. With time, it gets bigger. If it's a cruciate ligament injuries, will it be a moderate or will it be a huge effusion? In that case, a massive, you know, yeah, swelling or effusion would be there actually, and there'll be more pain and this and that actually. All right. So that's the biggest difference. And there's another line, joint line pain, which they didn't address here. But when you see the John Murtagh, there's a thing called if medial meniscus injury, medial joint line pain, lateral meniscus injury, lateral joint line pain, that is also a definitive sign. Okay. I hope that's clear. Here is a thing, differentiating point, uh, meniscus injury, cruciate ligament injury actually, but I think already I have mentioned actually. I mean, the best lines are that example, if you remember, of my next door neighbor, that initially it was small and he ignored, it's become huge. That's classic meniscus injury, and McMurray's test would be positive in that case. Whereas cruciate ligament injury, anterior drag test or posterior drag test, those things can be positive. So drawer, it's like a drawer. You open a drawer, so the foot you also do like this. Anterior drug test, positive anterior cushion, posterior drug test, posterior. Indeed. This physical examination, 100% important for MC Part 2 exam. Okay. So take a note. You will at least open the YouTube and type anterior drug test, posterior drug test, McMurray's test. Can you do that, guys? Comment in the comment section. Can you do that? I mean, you are also investing in your future, right? You can do that. Some of you already know, but maybe many of you don't perform or forget the exact technique. Please check it next time when you so from now on, these things will be in your hand. Next question. 58-year underwent a local excision of what? Melanoma, which is a black mole or something somewhere in the back. It can be in face. Now he appears in new form and swelling on the right axilla on right. What is the appropriate next step? For melanoma, we heard about breast loss, right? For melanoma, we have some breast loss. There's a thing we call breast loss. By that one, we know we separate grade 1, grade 2, grade 3, grade 4 melanomas. Melanoma has grade 1, grade 2, grade 3, grade 4, it's like that. All right, coming to the point. All right, so most appropriate next step in the management. Do you need a wide excision? Stage 2. Yeah. All right. Now we have another thing now presents with a new farm non-tender. Now is non-tender is a risky thing. Certainly, yes. Mm, how would you explain this lymph node thing? I mean, I'm definitely with wider excision, but wider excision, is this applicable here? Now, certainly you have a small melanoma here. You definitely prefer wide excision, but in this case, wide excision you considering first, or you do the biopsy of this axilla thing as well is more important in this case. You certainly need to, you know, check this lymph node, what's going on actually. So biopsy of this particular one is more important than you considering that wide excision, this and that actually. Yes. I think it's a suspected, I think. Without the biopsy, can we always confirm things? Not really, right? I think that's the point. I think we need the biopsy in anyway. We also need to apply. So you see that new axillary swelling post melanoma excision raises concern about lymph node metastasis actually. Okay, so in this particular, so correct approach would be diagnosis first. First would be biopsy to rule it out, the sentinel nodes actually. Okay, and to do the accurate staging at the same time. Yeah. So recommended more than one breast loss thickness, more than 1 millimeter. Yeah. So directly excision without is inappropriate. So I mean, you need the biopsy. Later you can go for excision. You need to be sure that there was no advanced metastasis has not happened. Clear, guys? If advanced metastasis has happened, you cannot do the typical surgeries. Clear? Because it will spread even more. is cleared like that. All right. So you're basically going with a stepwise approach actually. Biopsy, get clearance. Yes. All right. So biopsy here is the priority to rule out if it's a metastatic case or not actually. We will upload a inquiry zone. I mean, if you still have doubt on that question, you can raise that concern there later. Okay, and then let's move to the next one. Yes. Okay, before going to that one, maybe in a minute I can show you something for the melanoma, if you give permission. What different way melanoma is usually tested in the exam? Would you like to see that one, guys? What in different 5 ways melanoma can be tested? Would you like to see that one? Yeah, I can show you in a second. I'm just taking a second, guys. Yeah. All right, ready? Let me know if you are ready. I can just edit this one quickly. These are the very different way in my some of the previous years of teaching. These are the different ways I found melanoma coming in exam. Right, guys? Okay. We also found like very long back used to come. Nowadays it doesn't come. The melanoma types actually. Melanoma will be given as a mole in the back, in the face, and this and that. So superficial spreading is the most commonest type. Initial management almost always excisional biopsy, right? But it depends on the breast loss thickness or breast loss law. If it's a small one, 2 millimeter margin always minimum, but again depends on the breast loss law. You can check the breast loss law by going to the Google. You can just type it, you'll find it. Melanoma screening, either the Red Book or the RACGP. This particular batch has a screening related session. Actually, in that screening related session, I will clarify you the melanoma screening things actually, because if primary family previously affected or the person has a sunburn, five dysplastic navy, they are high risk category often actually. So ruling out those things, I will taught you in some days. But if you want to study in advance, you can type melanoma and then type RSCGP and then can study by yourself. Only this section. Yeah, huge risk factor is for dysplastic navy, especially if 5 is present by any chance, any huge risk factor. And also primary relative like a mother affected and like this. Okay. Very popular in the AMC exam is how do you see the prognosis actually by checking the depth or the thickness actually. So please remember the word thickness. A similar question also available in the handbook. There's a question given for the pediatric melanoma in eye actually. The only thing you can do is inoculation. You cannot keep melanoma by radiation, extremely metastatic in nature. Okay. Another question was given farmer, I mean living, so sun exposed is very popular. Sun exposed, sunburn related questions would be there. This brings us to the point, sun protection. Sun protection one of the primary thing that is taught in Australia in the school levels, like a 13-year girl is sun protection is very important. 10 to 3 p.m. is very, very important. When you are reading melanoma, I would highly recommend you to also read about basal cell carcinoma and squamous cell carcinomas. Actually, very, very important. And this screening part, I'll definitely tell you guys in future. All right. So these are in different ways, including melanoma, basal carcinoma, squamous cell. They give you a picture and they will test you in the main exam. This kind of question. These are the way questions are given. Yes, actually. All right, guys. The lecture will be posted, so don't worry. And you can also access this lecture through the drive during the course and 6 months after the course for the recall course. 35-year man brought to the department, not set for 5 days. This is a very, very dangerous thing. Did you know if you have sleep issues, you are very prone to have heart issues? Guys, did you know this? Anyway, if you have sleep issues, I mean, generally I'm talking. Like if you have sleep issues regularly, very prone with the heart issue. If it's continuous, if it's all of a sudden, you can deal with it. But day to day, that's dangerous. Spending excessively, then grandiose business plans, speaking rapidly, so many ideas, but nothing goes well. We made a diagnosis. Okay, super active, but nothing fruitful. Diagnosis, please. Super active, nothing fruitful. Diagnosis, bipolar. Now, if it's a bipolar, is it valproate? Is it lithium? Is it carbamazepine? Valproate. Definitely valproate. Lithium has so many side effects. Yes. All right. There's a nice website I can tell you. It's free actually. Name is MedBullet. Have you heard about this name? MedBullet, medbullet.com. Yeah, very nice one. Yeah, you can check it. They also will tell you that, so for manic cases, this case is bipolar cases. So this is a bipolar. Diagnosis is a bipolar. Yeah, like the mania. Is it clear, everyone? Lithium has so many side effects. That's why, we don't prefer lithium. And if you go with lithium, weekly CBC will be required, right? Weekly CBC and chances of thyroid problems and chances of renal, many other issues would be there. Okay, so we are preferring sodium valproate. 26 years, so many. 26 registration and perianal chordometachymeter. I hope you are guessing the name. I'm not telling what is this thing is meant. She has two previous courses of cryo. Now it's more clear what is your diagnosis. Can anyone say what's the diagnosis here? I mean, condylomata is, yeah, and treated with cryo. You understood, right? Like, which both failed. So cryo failed for a particular growth. Yeah, HSV, ward. These are real lines. So if you're thinking HSV, if you're thinking of the word, if you have a cryo failure, yes, you're in right direction. Then appropriate management. Unfortunately, they didn't mention the size. Original exam will mention high likely the sizes, but I think since cryo is failing, probably it's more bigger or complicated. So which probably required, I think, the surgical or maybe it's bigger laser treatment actually. Laser surgery is also called or surgical, whatever you call it, under one umbrella. So I think surgical sounds more better because initial is cryo. We also repeat the cryo in these cases. Speaking about the word in pregnancy, some treatments are contraindicated. Did you know? Yeah. She's pregnant. Yes, that's why few things are contraindicated. Like what? Like podo. Podo is contraindicated. Imaquimod is also not so safe actually. I mean, yeah, but podo is like absolute. Then also imaquimod. Those are some additional actually. Now, that brings us to the question of someone is asking, what since she's pregnant now, when surgery is indicated in pregnancy for a ward case actually large or extensive failure treatment cases. So there is nothing like a huge contradiction. Rapid growing lesion obstructing birth canal. Even if you think like, that in this particular area, if it's getting bigger, that can affect even the future chances with the fetus because if it's obstructing the canal. Did you know the wart can be so big that person's structure can be changed? There was a name I forget, like, dark night or something, what it is called. Yeah, I forgot the name, guys, actually. I mean, there's a person who's every area, even from the ward, some particular, small insect came out, even. I forgot the name. There's a, anyone knows the name? No, I forgot that name. Podo means podophylotoxin. You can Google it, my dear. It's a treatment module. Yes, treatment module for the word. So what has certain treatment module like podophylotoxin, imaquimod, laser, and the cryo. The cryo is most famous of everything. If everything failed or very large, then you can think about laser or laser surgeries, this and that. Yeah. All right. So large and failure case that is matched. That's why we do it. What to avoid? So portofilatoxin, imaquimod, vaccines because it's often dangerous. Yes. So these are things to given. These are things to avoid. All right. So it's a treatment failure case. Basically, we are addressing this one as a treatment failure case, going for a surgery or laser surgery. Thank you. Next one we are going through. Yes, this is straightforward. Researcher wants to determine hospital rates associated with birth weight. Rotavirus rates are associated with birth weight. They're doing a trial. Okay. Both variable measures in hospital record. The researcher wants to examine relationship between two variables without any experimental interventions. What study design is most appropriate here? 28 daily cases, we are going cohort type of studies. Yes. Why? Okay. So a prospective cohort study follows population order measuring exposures and outcome. Exposure and outcome. Yes. So assessing the relationship between variable without going for the interventions actually. Uh, can you give me an example of randomized control trial? Example, if you want to see the effectiveness of vitamin C in a particular community, right? Then it's more like a efficacy of a drug, yes, effectiveness of vitamin C. Yeah, vaccination. So that's more good with the RCT, randomized control trial. This one is more good with the prospective cohort study. All right. Next one, popular 28-year and certain issues, and please check the vitals not looking okay. Absent breath sound, distended neck veins, and trachea midline. All right. Diagnosis, please. I'll give you 10 more seconds. 5 more seconds. Some people not answering. Their chances in MC get reduced when you not participate. Well done. If you're thinking pneumothorax, you were somewhere very close. Yes, and if you're thinking tension pneumothorax, you are absolutely into the point. Now, vitally unstable goes more with the tension. Absent breath sound goes more with the tension pneumothorax. Right? These are few particular points for tension. That is an absolutely emergency, right, guys? So absent breath sound on affected side and the hypotension. Yeah, you can say Beck's triad actually. Yes. Right. Is it a emergency condition? Okay, good question. Someone asked trachea midline. Not all tension pneumothorax. Actually, most pneumothorax it does not push the trachea always to the out of the line. Actually, all right. Yeah, that's the thing. Yeah, sorry. Beck's is for the trend. Yes. Sorry, my bad. Yeah, Beck's is more for the cardiac temperatures. Yeah. This one you're dealing with the tension pneumothorax. And another bigger emergency is a cardiac tamponade, which is related to more extra like muffled heart sound, right? Breathing issues and this and that. So there's another bigger emergency. Tension pneumothorax, you take the needle, second intercostal space, piercing. We call it needle thoracostomy. Needle, you will also find this thing in the exam. I'll show you in the next page. Tension pneumothorax, I mean pneumothorax, we have a note in the note section. Please go to that one area, the pro cavities. These all things are important for specific. This is called, that's why you call that this note is absolute blender, absolute, unmatchable for AMC. Yeah. So exam specific. So breath sound, is affected in pneumothorax. Percussion note would be hyperresonant. This is versus, hemothorax. In hemothorax, percussion note would be dull, whereas hyperresonant in pneumothorax, very popular in the exam. Sometimes they give pneumothorax, sometimes they give hemothorax. Now, for pneumothorax tension, needle thoracostomy is very, very important. Regular pneumothorax cases, chest drain. Even in tension pneumothorax cases, needle thoracostomy release that air, then you give the chest drain. Regular pneumothorax, because situation under control, you just simply give the chest drain. Question also will come regarding, they will give you an X-ray and you'll see tension pneumothorax. Most of the cases trachea will be shifted. Some cases trachea may not be shifted actually. Depends on the vitals and the other scenarios actually. In MC exam, we don't expect every single parameter should be given as per the textbooks actually. Few of the points you have to make the diagnosis like that. All right. Special suggestion related question come. They give you scenario this that they will tell you in the end this is pneumothorax, but what right suggestion you want to give? Anything that puts pressure on the lung, you cannot do that. Like air traveling, underwater driving, and any similar activities like that. Air traveling, underwater driving, anything similar like that, you cannot do. Last but not the least, important in the management for regular pneumothorax rule of 25. Rule of 25 depends on the percentage of the lung collapse. Yeah, so less than 25% cases you do observe. It's a something available in the John Murtagh. Yeah, so anything less than 25% is just observed. If 25% are over, chest strain. This one related also a lot of question comes in the exam. So I said the additional theoretical things. Do you like the explanation, guys? Let me know in the comment section. It takes maybe 2-3 minutes extra. My voice got actually into a lot of pressure, but I think sometimes adding the top diseases, what extra to study, it can be helpful, even though it takes a little time. Yeah, some people like, because we have done, I have seen so many students, there are certain groups, sometimes they say, Doctor, can you just go quick? I mean, I understood some people like it. I understood some people like it, but understand one thing, if you just buy any question by there's so many questions given, but exam is more about differentiating DDs. They'll put you in real trouble, real scenarios. Yeah, and now in 2026 they said they will even put you in even more pressure with even more realistic. So all this experience will help definitely. With the cystic fibrosis, woman known as cystic fibrosis, age not mentioned, I mean, child with her partner planning, no family history of cystic fibrosis, and but is of Northern European descent who they have a lot of cystic fibrosis by the way. They already have a child who was diagnosed with CF. Uh, what is the risk? The next child of cystic fibrosis. Interesting question. All right. Am I right or wrong? If I'm uh, right, that's a big blunder for many of you. Sometimes we call it bamboo. It means in our country, you call it bash. What you're expecting, not getting it. Okay, coming to that particular point. You all must be knowing about something, autosomal dominant, autosomal recessive type of things. Okay. XX, okay, for the female and XY. Okay, so this is usually for the normal cases actually. So I mean, okay, uh, you bring a picture. First, you check one thing. Is this woman is a carrier? Is this woman is a, you know, diseased? Normally, that particular thing you guys know that is for the carrier mother and a carrier father. Yes. Carrier. This is the classic one you know for cystic fibrosis. Carrier mother, carrier father. Carrier mother, father when crossed, then you have a has cystic fibrosis one. So any child has a 25% chances. I hope you remember the crossing. One matched with another, matched with another. When from the both parent, one particular gene matched, then that is the one that is diseased. So rest others, two can be carrier, one total normal, and one is a cystic fibrosis. But in this, our case, like this, the mother has cystic fibrosis, diseased, and the father is a carrier. In that particular case, actually, do you think the ratio would be the same? No. Now you have 50% chance of uh, the next generation would be affected, and two of them would be carrier, nothing would be normal because mother has. Yeah, great. Oh, it's not mentioned, but I mean, it will be. Otherwise, this question wouldn't be made actually. Okay, my dear, you have to understand few things actually. Or in the main exam, they will tell you more clearly. All right. I mean, otherwise, this question would have been there. Further career. I mean, not mentioned, but understood these things. Everything is not specifically written always. Yes, it's a basic. I mean, otherwise, this question is abstract. I mean, if one of them is not a carrier, the future child of getting affected, this question won't have come in, right? So further here, yeah, even Northern European background, so more chances. Yes. So anyways, father is a carrier and mother is a disease. So 50%. Is it clear now, everyone? Is it clear now? Normally, autosomal recessive 25%, but if mother is diseased, then 50%. Very, very tricky question, right? Very tricky. So this is one of the reason you join us. Yes. Oh, how many questions? Okay. Next one. Let's go a little faster for we have another session. 3 weeks old and referred to persistent jaundice since birth. Mother is breastfeeded, gaining weight, appropriately local urine appears normal in colors to yellow. Mother is a negative, but that negative, a similar question in past. What is the appropriate next investigation? Basically, child with jaundice. Title, child with jaundice. 3 weeks, in fact. They didn't mention one thing when actually the jaundice has started. I think we need more information, and in order to do that, we need to know the serum bilirubin level, right? Yes. And bilirubin level also given direct, indirect, and all these things actually. Mm. So serum bilirubin, I think all we need at this point actually. Yes, some of you are correct. Jaundice persisting beyond 2 weeks requires investigation to exclude pathological cause. Yeah, particularly. So first thing is the bilirubin, then more other things will definitely come up. Yeah. So direct and indirect bilirubin, then you can rule out and get the more clear idea. Now, why jaundice can be dangerous for small children? Because it can cause very, very dangerous cardiac arrest. We have a neonatal jaundice in the SMA note in the pediatric section. You can have a look on that one. Child with the jaundice, lots of question comes in the main exam actually. All right, let's go quickly because we have another file to cover today, a little longer. Okay, 40-year man following high-speed MPA and certain injuries we can see with the chest strain given, vitally unstable. What's appropriate next? Looks like a frail chest. If it's a like a yeah, is it a frail chest or is it a pneumothorax more likely, or is it a hemothorax more likely? So flail is the mention, but understand one thing that flail means it can be associated with pneumo and the hemothorax altogether. Yes. So I think it's better emergency thoracostomy. That's yeah. So I think blood will be yeah there in that field. Yes. So the drainage of this amount of blood, it's indicating towards the hemothorax. Previously, we have shown it can be given as a diagnosis. In that case, reduced air entry and percussion or dull. This is how it will be. It can be also given, or it can be also given as a management, as emergency. Yeah, thoracotomy. Yes. Hyperresonant percussion or pneumothorax, dull percussion note in case of hemothorax. Since blood drain, so it's indicating towards the hemothorax. Quickly, let's finish this file so that we can start the next one. Guys, I'm not reading this question. Quickly go through this question and let me know. With the 65 years with the DBT, let's go with this question. He is at high risk for this scoring, no anticoagulation at this point. How long this post-operative prophylaxis is enoxaparin. Enoxaparin is nothing but a low molecular weight heparin. Enoxaparin is a nothing but low molecular weight heparin. So everyone, yeah. So it's a specific question, specific thing. Following total hip replacement as per the Australian guidelines recommended. Yeah. So it's a specific. If you know, you know actually. So you can search with the DVE prophylaxis with the RSCGP, you will find this reference actually. This kind of thing, if you know, you know actually. Next one with a TPL fracture is very, very important for the exam, guys. And there are gradings of actually, like, Gustilo grade 2, they say it actually. And open tibial fracture with contaminated bone, distal pulses are intact. X-ray confirms it's a classic tibial fracture, appropriate next step. Yeah, it looks easy, but some cases it creates confusion. So question is like, are you going for a debridement or going for an antibiotic thing first? Antibiotic first. Always a shot of antibiotics. It takes just few seconds. All right. This can help. I mean, for dealing with few things. Tibial fracture. I would recommend you to check tibial fracture from another website which called Ortho Bullets. Okay, they are related to Med Bullet. Ortho Bullet is specific for ortho, but more detailing things are given actually. So for the open fractures, immediate priority, I have antibiotic. Ideally within the 1 hour. Yeah, that's the thing. So you need to give a good coverage, otherwise your surgery can be successful, but patient can get affected with anaerobes or things like that. All right, one more. A 50-year with a 4 months fatigue, poor appetite, this that scenario is given with the calcium level is been mentioned to be with the alkaline phosphate elevated, PTH elevated, likely diagnosis. Classic, I think, very classic. PTH, parathyroid hormone elevated. So and parathyroid hormone elevated mentioned. So what do you think? What is the classic one here? It's absolutely final answer would be primary hyperparathyroidism. I hope you must be knowing about this thing, stones, bones, cones, bones, right? In hyperparathyroidism cases, it's PTH. Okay, so it's imagine this is the bone. So from calcium goes to the blood vessel. Calcium goes to the blood vessel. Okay, by osteoblastic. So it's a bones. So bone to the blood. So more calcium going from bones to the blood. Bones are losing calcium in some cases, but blood calcium level would be increasing actually. That is how actually. Then stones. Now, if your blood has more calcium, that will affect the kidney at some point with stones. So that is why we call the kidney stones. Now coming to the bones actually. Bones, what does it mean? Abdominal bones. Now, calcium can cause constipation, so abdominal pain, this kind of thing. So this is a possibility, abdominal cause. And last but not the least, it is been seen hyperparathyroidism is one of the thing hormonal that can change the personality a bit. That's why the psychiatric modes actually. That's why psychiatric mode. So very classic presentation coming to the question. If you check the initial one and the calcium level is that, yeah, parathyroid hormone's job is to elevate the serum calcium level. That is the thing. And phosphate, it is PTH, parathyroid hormone. Main job is to increase calcium. But another thing they do is phosphate level decreasing. That's why it's also calling phosphate trashing hormone. PTH, phosphate trashing hormone. You can remember this thing as a mnemonic. Main job, increase calcium. Another side job, decrease phosphate. Clear, everyone? I hope that's a good explanation. Yeah. Again, menopausal related questions are very important. Menopausal bleeding, menopausal dryness, menopausal this, that. And now this time postcoital bleeding, we have a very amazing note on bar vaginal bleeding on SMA note. I will try to open that one if I get time. She's not on her HRT. It's too early for HRT, right? Pap smear to Lagos normal, normal scene, Bioman result. Okay, what do you think? Postcoital bleeding for past 3 months. Interesting question. Okay, we need to understand few things. Is this one has some time passed, like 2, 3 years, that estrogen deficiency is causing dryness? Not really. All right. Otherwise, 50 years, just like menopause has happened and there is bleeding started after happening proper menopause is always endometrial cancer until proven otherwise. Did you know this info? Any postmenopausal bleeding suspected endometrial cancer until proven otherwise. I took up the screen. Did you know this information, my dear doctors? Bring back the screen. We do have this note, amazing note, SMA note. So gynae related few things are given. Yeah, so some explanation of this note. Some other day I will explain the uh, perimenopausal one. Let's discuss the postmenopausal one, why this note is so unique. 50-year recently menopause, but don't go with the 50 years, but menopause fully not happen. Now, what do we mean by that? What is the definition of menopause? Is it like it has to be one full year, complete full year without any bleeding? Are you getting me? Menopause can happen also in 48 years. Menopause can happen in 49 years. So a complete 1 year has to happen. But in this first case, this one, I'm talking about this one, if in between, if there is a bleeding, why is this bleeding? Is it because of that cancer or is it because of some functional ovaries can be there? Answer, the red one. anovulatory cycle, Graafian follicle. Some ovaries can be, I mean, ovaries are going, but some ovaries is still sometime activated. It's like that. So anovulatory cycle or a Graafian follicle remnant. That is the reason. If it is said 60-year postmenopausal bleeding or other any particular age postmenopausal bleeding and they don't give you symptoms, it's always endometrial cancer until proven. Any postmenopausal bleeding, endometrial cancer until proven otherwise. Please confirm in the comment section if first two are clear. Now coming to the special causes like postcoital and lots of pain at this painful coitus they mention, and some time has expended after menopause, like 2 3 years. So estrogen is more lacking, and over the time, vaginal atrophy has happened, and that is causing these postcoital issues actually. So that can be atrophic vaginitis, most cases lack of estrogen. If you give them estrogen, patient would be fine. Or also suggest to use loops. Yes. My suggestion, I mean, atrophic vaginitis cases, they will tell you postmenopausal, usually will be given 53, 54, or 55. Yeah, and some other postmenopausal symptom will be mentioned alongside postcoital bleeding. Clear? Someone asking this question? Yes. So not only vaginal atrophy, but they will be also telling you some postmenopausal symptom thing. Uh, Polyp related things. See, polyp is like usually more common in early, not like polyp, you get growth. For polyp, cervical cancer, when you examine, there will be some growth actually. All right, that's how the thing is. As I said, this file has all the explanations. Some other day I will explain all this thing. And last but not the least, postcoital bleeding can be also, it can be cervical cancer, but few lines should be given. Like what? Like, let's come to the question. Her PAP was done 12 months ago and was normal. Can it be cervical cancer then? Great question. Oh, if cervical cancer, they will say no previous PAP in recent time, or they will say a growth. They would say the person has uh, infected by HSV in past. So there will be some high risk factor histories or multiple sexual partner in past. So these kind of points would be given as separate or cervical growth by Cascos examination. Clear? They'll give you some hints if cervical cancer. Clear? I hope it is. Yes. Yes, yes. Well done, guys. Oh, good. Uh, yeah, it's a good note, right? I mean, yes. I already mentioned why not cervical cancer. Yes. All right. Next coming 16-year boy brought by the GP, mother due to swelling of the left breast. Breast related question, so important. Mother is healthy, any medications? He's at a tenor stage of the 4 of puberty. What is a likely unilateral gynecomastia? Another popular topic, breast related and the gynecomastia. This is a boy with a swelling in the breast, so obviously it's going toward the gynecomastia. Check his age. Very, very important. Checking age for gynecomastia. Come on, everyone. Many of you are answering physiological gynecomastia. Okay. They didn't mention it's a player, NBA player, football player, professional athlete. So first of all, I think the anabolic steroid is out. Okay. The person may have using fluticasone, but that usually does not cause that kind of gynecomastia. There is a line called 2 to 3 years after puberty because of hormonal changes. Guys can have little bit growth in the breast area. Actually, it's totally often physiological. Actually, it can be physiological. Often it can be physiological. Here is the lines. So often given like a 15-year or something. So physiological gynecomastia. Just you reassure. It's a handbook question. 17 years idiopathic, 17 years idiopathic gynecomastia. I mean, you don't find any calls. 19-year mentioning professional football player, drug related, anabolic steroid, actually. Yeah. Yeah, 16 year very late. I mean, and they'll give you clue that football, basketball, professional athlete, bodybuilders. Yeah. No clue in our question. No clue in our question. So it's not anabolic. This becomes more confusing, especially this question is given. Check this question, like just 17 year and just asking you the no clue. MC also do that. They don't give much clue as you were expecting as per the textbook. So idiopathic, no physiological, testicular, capacity, this, that. So physiological, there's a line that 2 to 3 years after the puberty it can be, but 17 years is way too much for pubertal. So that is usually idiopathic actually, or even 18 years can be idiopathic if nothing clues are given about athletic. Yes. My dear doctors, is it clear about this particular question? Is it clear about that particular question? Wonderful. Next, a 35-year man presents with a 1.5 centimeter, okay, a smooth non-tender transmural swelling in the right upper right scrotum discovered incidentally, no pain, is that. Ultrasound confirmed a simple epididymal cyst. What is the next appropriate management? Yes, yes, please. Check the age, check the problem, scrotal, scrotal problem, testicular swelling, non-tender. So our title is non-tender testicular swelling, appropriate management. All right, guys, let's go with the answer. All right. Now 35 and yes. Okay, we do have a SMA note. Usually in the 5 months course, we explain the notes and John Murtagh separately. But in even in this recall course, SMA note is given in the surgery lecture note one. You will find few things related to testicular, this kind of thing. So this in this case, we diagnose mainly as a epididymal cyst. Now, if it's a cyst, you are thinking more. A repeat ultrasound already confirms cyst. Now, is it a cancer? Not really. Do I need to be worried? Not really. All right. So it's simple. In that case, reassure and observation. Is it clear to the dear doctors? Is it clear to our dear doctors? I'll show you one more slide if it's okay. Mm. I like to show, I mean, few additional things. Um, Maybe it's already taken from John, but I can take a picture. This one just I'm showing as a extra. So I'll put the recording as well, don't worry. So hydrocele, seal, epinocarditis, yeah, varicocele, yeah, and another one, painless cases can be. So painless cases, not only cancer, but can be varicocele, but can be cyst, but can be hydrocele at the same time. But if it is a simple cyst one, then you don't have to worry much. Just reassures. If it's a left-sided bag of worm-like feeling, varicocele, yes. By the way, testicular cancer can be given in the main exam. Okay, clear everyone about testicular, that particular question? I'm trying to show more John Murtagh things if you have noticed, because I find them more reliable than any other thing. Okay, 8-year boy referred persistent defined. So childhood abnormalities, childhood behavioral related questions are very popular in the exam. It's a quite a blended question came in this last April. Yeah, with more some of the questions from pharmacology as well in this particular April actually, which we are also collecting. I think more pharmacology question will come in the coming days. Now, persistent, defined, and opposition behavior, they argue too much. What you can say, argue and annoys other, maintains normal friendship, has a normal intact eye contact, which is good news. Performs academically at any grade level, no history of conduct or aggression. So it's not a conduct, I think. Okay. And just 8 years. So if 8 year, we are not thinking about contact, but ADHD we can think about actually. But this one is mostly they argue, they don't come into a point. So this one going more with the opposition of defined disorder. If you develop in ADHD, hyperactivity, this, that, very aggressive kids, it's not ADHD. Remember one thing, ADHD age groups are also 5 to up to 11 years actually. All right. This one is also kind of same like school going actually, school going like this particular. Contact on the other hand, 12 to 18 years actually, and more than 18 years, it's called anti-social. Don't forget to check our SMA note in the note section. And in this case, they mention intact eye contact. So this is against the autism case. Everyone clear? My dear doctors, is it clear? I hope so. Okay. 29-year-old with this 26 weeks of gestation means again pregnant. Guys, antenatal visit related questions are popular. And yeah, multiple healing bruises. Very stage of arm and okay, that does not look good. She hesitant to explain how she got them. We know where this question is going. Her partner present throughout the consultation, answer most of the question right. So dominant husband, allowing the wife not to speak. And so in this particular cases, we always prefer in Australia to talk privately at least one time. Yes. So what is the first thing you can do in this situation? That's the twist. I knew it. You will answer B first. See, domestic violence, first answer, most people think, okay, safety. I also know it. If you see, like, there's some steps we follow in Australia because the next moment that guy can take away that person. If you have that opportunity, first, took any document, whichever you have actually first. Then the next point comes, okay, you call the security, safety, you talk to alone this particular point. Okay, yeah. So that is the thing. You need that evidence actually. Otherwise, you cannot even complain. Your complaint may not stand. Later, they can sue you. Remember that. Yeah, that doctor has taken and he's telling this, that I want to sue you. The lawyers are always ready for that. Yeah. You're going to Australia, get ready for more money, but also get ready I mean, lawyers will be after you. Some cases actually. All right. So be careful, guys. In our country, a lot of things we don't bother actually. There, everything is perfect, but you have to be a little bit more perfect, especially medical rules, regulations. So this is a case of domestic violence. Collect the photograph and documents first, actually. First line responder. Okay. You can also check in these things in the RSCGP. And there's a title topic in RSCGP. Uh, you can search with this topic. All right. By the way, guys, our April also has more files. You can also check them by going to the April folder, which we have, I think, shown you already. I think we have already shown you the April folder, guys. I mean, would you prefer a extra? I mean, I was supposed to take a second session today. Would you prefer if I take that one additionally tomorrow? I mean, it will be more rest for you, I think, instead of doing today. I think because we have to explain and day one, yeah. I mean, Monday will be our regular as usual class, but since it's in another file, yeah, that one is will be July. I think it's better. I think we can see you guys tomorrow the same time. Yes, I think it would be nice. And I'd like to take few inquiries and already mentioned about how to utilize these materials and this that I'll upload that recording. So don't worry. Regarding this matter, anyone wants to join this session, actually, no, it's usually 300 but currently 250 this recall, and extensive program, 5 years recalls are given. And already we have mentioned that this is how it looks like when you enter. You see all the S7 notes, actually huge number collections on all topic, very unique for the AMC mocks. Systemized mocks are given here, but computerized we will take you very soon. I think the dates are given in the routine. You can definitely check the routine. And this is how the folders 2026 is ongoing. We just took that file one for you. The file two is already there. You can check today. And yeah, great. And at the same time, the February and the March, by the way, December, January, no exam. And if you go to some of the other files, 2025, you will not find December, January because there is no exam. It's more files, videos, everything given. Yeah, you can just go, just play. At least try initially 3 year. If you can more, then you can go for another 2 year. Highly, highly recommended. A lot of doubt, doctor, is it like question bank or is it the recall? This that is always recall, my dear. Is always the recall, actually. Recall is the directly question bank. A lot question, a lot of AI is being used. So many topics like how to exclude, which one is more important, less important. So the recall folder is exactly like the topics from the exams, actually. I mean, some people ask how to enroll. I mean, first of all, you can WhatsApp. Yeah, that's best. And yeah, secondly, I think I took up the screen, I think. Yeah, let me show one more time. Yeah, that's my Facebook. You can find me in Facebook easily. You can also inbox me in Facebook. Yeah. And we are talking about the folder. This is how the folders look like. Sorry, I think my screen was gone. So MC notes, SMA notes, all topics, as you can see, and all the years. 2025, all months. December, January, no exam. 2026 till April updated as like same. There's a few more April files out there. You can double check. It's already given there, actually. Yes, right. Uh, Again, last but not the least. Yes. Again, last but not the least, if anyone is so much beginner in MC, we are having a 5 months course starting from the 17th May. In that case, in Noxus, actually. All right, so that'll be nice. And if you guys can double check our website, would be also nice. Best possible way to contact is WhatsApp. Tomorrow we're taking an extra because we're supposed to have another file. And of course, Monday is another date is given, actually. And our so far, I think 50-60% admission is over because a lot of people know us from the beginning. We've made a renowned academy. And so maximum admissions are people took the admission early and took the materials. They have been using it. So if you have exam on July, August, September, even October, you can join this one. If you have November exam, then we will have another batch in August targeting for that, actually. All right, great. If you have personal question, you can inbox us. Would be really nice, actually, guys. All right. If you have July exam, this is the best shot for you. Try finish 3 year first, then the another 2 year, maybe you can do the files. Try finish all these explanatory videos. This is tomorrow same time class, my dear. Actually, if you have exam in October, I think you should join early. You will have access till the October, actually, so you don't have to worry in that case, my dear. Okay, the sooner the better in that case, actually. But if your leon is November, you can think about coming to the August batch. Taking admission in July would be good in that case, actually. All right, I hope you understand and everything is clear. Yeah. So I think links and things are given as well. Yeah. So you guys can check the websites and this that. I think best possible would be if you just leave us a message on Facebook Messenger. Be happy to answer, actually. Yes. Yeah, exam support is included. By the way, guys, exam support is 100% included. We are the first people who started exam support, and in our course, I mean, for all batches, exam support is a complimentary support actually. We don't charge separately. Yeah, like the one you are entering 250, some people might even charge more just for the exam support actually. And many are my students as well actually. Correct. Correct. Yeah, yeah, even after this course, actually. I mean, see, anyone is our student and need exam support. Someone exams, let's say, joining this batch, an exam in November, they can also join the November support group, actually. Support group is we say it's a right, actually. One more thing, anyone failed while attending, we allow taking the course free of cost later, actually. Okay. I think that's all. I'm opening an inquiry zone in our, yes. Where is that support group? My dear, support group comes when your exam will come actually. No worries actually. Support group means during the exam. For June, it's separate. It's July, it's separate. In August, it's separate actually. Yeah. So if anyone's exam is in June, so you keep eye on our video channel, and there's a group called video channel. In that group, we share the link for June then. I mean, now we are opening the link for the May support group. For June, 1st June, we'll open the July. Then if July, then first day of the July, support group link for the exam candidates will be shared actually. Yes, my dear. Yes. We'll give you more information later. I mean, for now, focus on the course. That's most mandatory. And you can us your exam dates. In that way, individually, we can guide you. Um, Understanding is important. I mean, as per the question inquiries is more important, but uh, try come to us gradually. I mean, too many questions can be today actually. All right, my dear. November exam booked. Then it's up to you. You can join now. Two suggestion, you can join now. Maybe another batch, another just $50 later. You can extend. Keep joining. I mean, practicing can be nice. Or maybe directly join from the August batch. Be also nice actually if someone examines November. Thank you everyone. And here are the things as you all can see. Like 1 year plus live we are doing, 5 years as a support. A lot of computerized mocks coming up. And SMA note, we have given you demonstration exam support group, complimentary, no matter which month you are, it's on us. Yeah. And we'll also upload a question bank for you. I mean, in coming days actually, currently we're in admission mode, so in next 7 days, we'll have the admission. So tell your friends this, that if they want to join, we'll upload this class shortly in YouTube, and after trial session over, the remaining classes you will find through the drive actually. This one will be also in the drive, so don't worry. Thank you. Good night, everyone. And I'll make a inquiry in the batch 68 Facebook group. I'm opening a inquiry zone. Any inquiries, ask me below, or any inquiries. Um, Okay, I hope so. That helps. We'll get back to all of you with so many questions. Thank you again. Actually, see you all tomorrow with a bonus session. You all can attend also tomorrow. Actually, I mean, that's also part of trial. Thank you again, my dear doctors. All right.